Well, when I came into the office, I was grinding my teeth. The dentist said that I eventually had some damage that looked like it was not going to be very reversible. Just something that I seem to have done for a very long time. But it was beginning to bother me. It was hurting a little bit. My bite just didn't feel as productive or comfortable as I would like. And so we talked about, what we can do to eliminate some of the pain and, make the teeth look better. And so that's when we began the process.
Phil presented to us with a mouthful of grinding. He had clenched and ground his teeth for years, and finally he had enough pain and discomfort at nighttime and during the day that he knew he needed to do something.
So after the consultation with Dr. Orenstein, it was determined that the best procedure would be to replace some of the teeth in there to cover the enamel with a crown.
Ever since Phil finished his work here, his gums have healed up, his teeth are feeling better, and he's back to living life in the fullest.
Yeah, now that the procedure is done, I enjoy my smile. I like that I don't have to sort of favor one side or the other. Sometimes if I'm eating a peanut on this side or a softer thing on the other side, I don't really think about eating anymore. I just can eat naturally on whatever side it is. So I'm very happy in the end that I took the time to do it, because now it's much more comfortable. And I guess the fact that I don't even notice it anymore, really a testament to Dr. Orenstein.